Berter is an organization that has been working for almost a decade at the U.S.-Mexican border across the city from Calexico in Mexicali, and it has provided services for different people who are vulnerable populations, people who inject drugs, LGBTQ, sex workers, and we provide an array of harm reduction services like needle exchange program, HIV testing and referrals, drug checking for fentanyl, overdose prevention with Narcan and naloxone, and since 3 years ago, we also have a safe consumption service only for women, the only of its kind in Latin America, and only the fourth of the world dedicated exclusively for women.
Hay muchas situaciones de violencia que viven las mujeres usuarias de drogas. Sufren violencia en sus entornos, con sus parejas, en la comunidad en general, con la policía, en la calle, ¿no? Entonces, en los espacios de consumo, además, es como una constante, ¿no? Que nos hablan de cómo son o han sufrido violencia sexual, por ejemplo, cuando están en espacios de consumo, cuando pierden el conocimiento, cuando sufren una sobredosis, pues en general no son violentadas por la comunidad. Entonces, ofrecer un espacio donde se sientan seguras, donde saben que no va a pasar nada, un espacio donde se sufre una sobredosis, las vamos a atender y vamos a buscar apoyarlas.
It's better for us to be off the street and not doing drugs on the street and in a safe place where nobody can see us. It's for our to better us and to better them. It's not just for us to fix, they also help us to get off drugs.
Verter relies on public funding and private funding. Unfortunately, the current federal government in Mexico decided to cancel in 2018 all financing for any kind of NGO in the country. These included harm reduction services in Mexico. So for the last 2-3 years, we have relied on independent funding from international sources like the Open Society Foundations and PHF. Also, we depend on private research money from universities both in the United States and Canada that allow us to do this combination of research and implementation in order to prove and generate evidence for successful interventions on public health in Mexico. So our plan for this year is we are having our third anniversary of this unsanctioned service for women. And unfortunately, since we don't have the support from the government anymore, we're trying to raise $20,000 for certain things. One is to pay us the rent for an entire year plus utilities, and to also put some money into our mobile van that will allow us to reach out more population outside from our fixed center. That's half of the money, but the other half of the money is really important to hire the staff that will allow us to continue providing the services. We will be asking for peer coordinator and also a harm reduction coordinator so we can keep open. Our safe consumption site is open Monday to Friday from 9 a.m. to 6 p.m. and we really would love to continue this service for more years, but at least we're asking for one more year to keep funding our services.
And if there's a lot of people listening, I wish they open up their heart and listen to somebody that needs help.